Hello, my name is Kwekwe. I'm a pharmacist. In today's video, I'm going to be talking about the medication propranolol, sometimes marketed under the brand name Inderal or Inderal LA. We're going to take a look at what it is, how to take it, some best practices, as well as discuss some common side effects. Now, as with all my other videos, this is for informational purposes only, so please do not stop, or make any changes to your medication regimen without first discussing with your doctor. So for starters, what is propranolol? Well, propranolol is a medication, belongs to a group we call beta blockers. It is approved for a variety of conditions, which I'm going to list on your screen now, but the most common of them are management of high blood pressure or hypertension, in the management of angina or chest pains, or sometimes in the management of irregular heartbeats. Another common approved use of propranolol is in the prophylaxis or the prevention of migraines. Now, there are also some off-label uses of propranolol, and off-label uses are reasons for which the medication was not necessarily approved, but they found out over time that it is good for those conditions, and therefore they use it for that. And key among them is the use of propranolol for anxiety. It may also be used in a condition called thyrotoxicosis, which is basically excess amount of thyroid hormone, which can be serious in some cases because it leads to an elevated high blood pressure, unexplained weight loss, fast heartbeat, amongst others. Propranolol, like all other beta blockers, work by relaxing the blood vessels so it's easier for the blood to flow through it, and also reduces your heart rate so your heart doesn't have to do excessive work pumping all the blood around the body. Now, how to take propranolol? Well, propranolol comes either as a tablet, an immediate release tablet, a solution, or an extended release tablet. The extended release tablet is typically taken once a day. It should be swallowed whole, not chewed or crushed. The immediate release tablet may be taken 2, 3, or 4 times a day, depending on what the needs are. And propranolol is really not noted to upset the stomach, so it typically can be taken without regard to food. So before or after food doesn't really matter. Only best practice is that if you stick to one. If you take it before food, always take it before food, and if you take it after food, always take it after food. That is just best practice, especially for the extended release capsule. Now, some best practice or what to expect when you start taking propranolol. Well, first off, propranolol may cause you to be dizzy, so it is best to know how your body reacts to it before you start doing things that require you to be alert. So before driving a car or anything like that, it's highly recommended that you take your first dose in a home setting, usually if the day you're off work, a weekend, something like that, just to see how your body reacts to it before you start taking it on a regular basis. Another best practice is that while you take propranolol, if you're going from a sitting to a standing position, do that gradually. Don't just stand up abruptly, especially when you start taking it or when there's a dose increase. This will help prevent feeling faint and falling, especially in older folk. Another best practice is that as much as possible, avoid taking alcohol while you take propranolol. Alcohol has been known to potentiate the blood pressure lowering effect of propranolol. So if they are combined, it may lead to a situation where you become dizzy, lightheaded, and sometimes even falls. Also, it is worth noting that propranolol and some other beta blockers have been known to cause blood sugar levels to rise in some people. So if you are diabetic or pre-diabetic, it's a good practice to check your blood sugar numbers to make sure that they are not going in the wrong direction. And also talk to your healthcare provider, talk to your doctor, and see if there needs to be any adjustment in your doses of your diabetic medications. That is, if you're taking diabetic medications while you take propranolol. Another best practice is that do not stop taking propranolol abruptly. If you have to stop propranolol, typically your doctor will taper you off gradually. This helps prevent a situation where there is an excessive increase in your heart rate, at a condition called tachycardia, which can be fatal in some instances. So please do well to gradually taper off your propranolol if you have to go off it. Now let's talk about some side effects. Now, side effects of propranolol are usually mild and usually are at the beginning or when you start taking the propranolol, and they typically wear off. Of course, if any of these that I'm going to discuss persist, it's best practice to let your doctor know and see, and for them to decide if propranolol is the best medication for you. One of the common side effects is headache. If you experience any headache while you take propranolol, best practice is to make sure you're well hydrated, make sure you're getting enough rest. And also, like I mentioned about alcohol can actually cause headaches when combined with propranolol. So please stay off the alcohol while you take propranolol. The next side effect is feeling tired or fatigue. And this, like I said, is usually at the beginning when you start taking it. Most people get used to it and you kind of get over it. Of course, if it persists, like I mentioned, discuss with your doctor. Some people may also develop cold fingers or toes. There's also been reports of nausea and vomiting. There's also been reports of diarrhea and stomach pain. Like I said, there's definitely a good reason why your doctor prescribed the propranolol. So if you experience any of these, just discuss with him, let him find alternatives if the side effects remain unbearable. High level overview of propranolol. Hope you found some value in it. If you did, give it a thumbs up. Stay blessed. Catch you on the next video.